we'll get started. Good morning, everyone. My name is Maria Jones, and on behalf of the World Bank and the Center for Effective Global Action, I'm delighted to welcome you to Measuring Development 2021, Emerging Data and Methods in Global Health Research. I'll start by introducing the organizations who are hosting this conference: the World Bank's Development Impact Evaluation Department, known as DIME, the Analytics and Tools Unit in the World Bank's Development Economics Data Group, and the Center for Effective Global Action. DIME generates high quality and operationally relevant data and research to transform development policy, help reduce extreme poverty, and secure shared prosperity. It develops customized data and evidence ecosystems to produce actionable information and recommend specific policy pathways to maximize impact. The work is based on a co-production model aimed at transferring capacity and know-how to partners to make mid-course corrections and scale up successful policy instruments to achieve policy outcomes. The group conducts research in 60 countries with 200 agencies, leveraging a $180 million research budget against $18 billion in development finance. It also provides advisory services to 30 multilateral and bilateral development agencies in the world. The Analytics and Tools Unit in the World Bank's Development Economics Data Group delivers data science products and analytical services to support World Bank lending and data operations. The unit was established to take full advantage of the increasing volume and diversity of data accessible to the development community. The unit aims to strengthen the bank's capacity and the capacity of our partners to exploit non-traditional data sets such as big data, geospatial data, unstructured data, including text, and others, as well as new methods such as machine learning, and to develop the tools needed to democratize these approaches. Finally, the Center for Effective Global Action is a West Coast hub for research on global development. Headquartered at the University of California, Berkeley, SIGA's large interdisciplinary network, including a growing number of scholars from low and middle income countries, identifies and tests innovations designed to reduce poverty and promote development. SIGA researchers use rigorous evaluations, tools from data science, and new measurement technologies to assess the impacts of large-scale social and economic development in programs. Through careful matchmaking, competitive grant-making, and research dissemination activities, SIGA ensures that the scientific evidence we produce improves the lives of people living in poverty. This is our 7th annual measurement conference and the second that we've held entirely virtually. We have a packed agenda for you with lots of exciting speakers. And as everything is happening in the same Zoom room, we're going to be very strict with time and we'll aim to stay closely aligned with the posted agenda. I see that we already have 99 participants online and expect more to be joining throughout the day. So please do also take the chance to chat with other participants and introduce yourself. I'm delighted now to introduce Arianna Legovini, the head of DIME. For the past 15 years, Arianna has worked to understand and develop the institutions required to engage researchers, operational staff, and policymakers in improving the quality in the design and implementation of development projects. She is currently responsible for a research program including more than 200 impact evaluations in 60 countries across the globe. I now hand the virtual microphone over to Arianna for some opening remarks.
Thank you, Maria. And welcome everyone to Emerging Data and Methods in Global Health Research. As Maria said, this is our 7th annual Measuring Development Conference conducted as a collaboration between SIGA, AUC Berkeley, and DIME and the Data Group at the World Bank. This conference features a new technology for development research, showcasing cutting-edge tools for targeting, tracking, and measuring the impact of development programs across the world. Each year, the conference has highlighted a different topic. We have discussed crisis preparedness and response, artificial intelligence for economic development, infrastructure monitoring, energy and environment, and last year, data integration and data fusion. This year, well, not surprisingly, the focus is on innovations in global health data and measurement, especially applications to the COVID-19 pandemic. We'll take stock of new tools and technologies for measuring global health, increasing our understanding of the pandemic, and providing solutions to shape our policy response. In the last 2 years, the world has generated more data than in all of our history combined. So the question is not data, but how to turn data into information and policy actions. And the simple answer to the question of how to turn data into information is research, and specifically how to leverage and expand our limited research capabilities. It is said that vaccine technology has leaped 12 years in the last year alone, thanks to global coordination and financing. Now, development economics has been making major advances as well during the crisis. And by working together in ever more collaborative and interdisciplinary fashion, I think we can secure sweeping advances in research-based development policy solutions. This is part of what we are trying to do here with this conference, is to stimulate more sharing and collaborations across researchers as well as fields of study. Over the next 2 days, we'll learn about the new data and analytical tools to measure and analyze facts and behaviors that affect global health. What will become imminently clear is that the nature of global health research has already changed, as the technological revolution is greatly expanding the potential for research and policy applications. Within that revolution, the COVID-19 pandemic has been a catalyst for innovation, forcing us to be more creative on the uses and integration of different data and tools to shed light on drivers of the pandemic and the associated economic crisis, as well as ways of addressing both. Between today and tomorrow, we'll have a wealth of discussions around the use of Facebook to administer global COVID symptom surveys, to using artificial intelligence to analyze COVID trends from Google searches and social media, or using call detail records from mobile operators. And Facebook data on co-location patterns for epidemiological modeling or real-time batch geocoding. Today, we feature 3 panels of research presentations, a keynote from Ziad Obermeyer, and a round of lightning talks. Tomorrow, you'll run interactive sessions with Esri and Atlas AI, thank you very much, and learn about a wealth of open source global health data. We will also have 2 more panels on under-researched topics in global health, measuring quality of health and mental health. So we are ready to get moving. And I'd like to introduce now Sam Fishman, who manages SIGA's technology and data science for development programs and works on innovative approaches to data-intensive measurement with the Development Impact Lab, the Geospatial Analysis for Development Initiative, and the Targeting Aid Better Initiative. He will chair our first session on leveraging online and social media data for COVID-19 response. Please join me in welcoming Sam and the rest of the panel. Sam, to you.